Hello and welcome to the second podcast in the series of the Mad Englishman with the Little Guitar and the Big C. I have to say that unless there's evidence of plenty of people watching this podcast, then I will have to play the ukulele. You really don't want that, so please tell people and get them to watch it. Okay, so the first part was about some background to my particular case, and really some of the things that you need to be aware of. And I'm joined again by Wendy Lilly. Got to say that, sorry. And really, it was focusing quite a lot on towards the end of it, focusing quite a lot on post-diagnosis and dealing with others and dealing with how other people view you and how other people view the fact that you've got the big C. And there's a lot of difference amongst even friends and family about the way people react to you. Dealing with others is only one aspect of what you particularly have to deal with between diagnosis and really getting into the treatment. The second big area is basically dealing with the NHS. And I said before in the last one that I absolutely put all my faith in the professionals of the NHS, and I was right to do that. And with very few exceptions, it was a very positive experience. But it's a big system. It's a big system with a lot of people and a lot of complicated interactions. And the trouble is, as patients, we just don't know the system. We don't know how the system works. We don't know how the system is supposed to work. And I think I found myself dealing with probably 6 or 7 different NHS departments. And it was quite frustrating because knowing that in many instances, those people that I was trying to deal with were probably working within 20 meters of each other. But because they were different departments, they could have been one on the moon and one on Earth. So the various steps were the initial diagnosis in a very busy ear, nose and throat section, and you know it is very, you know, obviously very busy at Northampton General. The diagnosis is always the most difficult thing, and there's plenty of boxes of tissues available and that sort of thing for obvious reasons. The next stage then, which was a bit concerning as to what it might involve, was the biopsy. Now, as operations go, that was pretty straightforward. In overnight and out again, and quite an easy recovery compared with some other operations that I've had. The next stage then is that it goes to what I think is called the multidisciplinary team that starts to involve. That's where you start to involve lots of departments, and that's the sort of, you know, the entry of the oncologists. And I've got to say, one from radiotherapy and one from chemotherapy, the two were absolutely fantastic and were really sort of took you through what was going on, etc. You then start to feel almost a comfort blanket thrown around you because you've got the oncology team, you know, and they're working together. But then you start to have to involve other parts of the hospital and parts of the health service as well. You're given lots and lots of pieces of paper, and one of the quite thick booklets is about your PEG tube, because. And again, this filled me with horror that I had a tube going into my stomach that I would feed through. And more to the point, it had to be fitted through an endoscopy, and I know that I've got really quite a bad gag mechanism, and that if anything goes anywhere near my throat, then I will gag. So I didn't feel that I had any sort of personal face-to-face help with that. I got a lot on radiotherapy, a lot on oncology, because that was within the comfort blanket. Endoscopy was a different department. It also didn't help. It was right at the other end of Hospital Street anyway. And there was a whole aura about endoscopy that is, well, they're very busy. They're very busy. You know, you might be able to get fitted in over the next sort of couple of weeks, but and it was that was probably one of my biggest fears of the whole thing. But I went down there. Yes, it was very busy, but again, a very nice team down there, a very helpful team, and an overnight stay, which you have to have an overnight stay with it. And then this weird thing of having a tube through something. I still have the tube in my stomach now, and I've got to say, I've only just stopped. Last week, I stopped taking supplements through it. I'm still drinking. I'm still taking some supplements, but I'm drinking them. So I think I got it fitted in April, and it's still in now in November, and it's nothing. It's not an issue at all. You know, it's just need to look after it each day and make sure you poke it back into the stomach and move it around. So it's really weird. I can't understand why I'm allowed to go swimming, and I've got this hole in my stomach, but it works right, and it is now part of my normal day. But I personally was quite worried about that, and again, I was trying to coordinate between the endoscopy department down the way and the rest of the thing. I then had to have a Pickline fitted. So when it's a tube, not a tube, part 2, when it's a Pickline, and this is a line that you have fitted into a vein in your arm, and it's pushed up into a vein somewhere around the base of your neck into another vein, and that was actually a godsend for me, because my veins are particularly bad, and even having a blood test, I sometimes come out with 7 holes in different hands and arms, so people can't find veins. And I was a bit concerned about having chemo on that basis, because where I've had a lot of stuff pumped in through a cannula, it's become really, really sore for me. And but the Pickline was fantastic. Had that put in, and of course that meant that any blood tests, anything that needed to go in or out, went in through that, and including the chemo, which was absolutely fantastic. So, but that again, another department. So that's a department within the X-ray. So trying to coordinate all those things. I didn't feel there was anybody sitting and coordinating it on my behalf.
So when you say coordinate, were you ringing the department?
Yes,
trying to come up with dates that fitted you?
Yeah, trying to sort of find secretaries, the right secretaries to talk to, and that sort of thing about it. Mine was complicated, I must admit, because I've been on warfarin since 1995, I think. And if you're on warfarin and you have any sort of operation, you have to come off the warfarin and have injections in your stomach before the operation for a week, and then for 10 days after the operation. And I just thought, I really don't want to do this, so I wanted to go on to another drug which thins your blood in a slightly different way. So I was trying to so that meant the anti-coag department was involved, and hematology and oncology, and so it was just trying to bring those things together. And then again, out of the blue, 2 things. One, you have to go and have a hearing test, which is not a particular issue, but I don't remember seeing that in the program anywhere. And then you have to have a dental examination, because you can't have a kind of any dental treatment while your radiotherapy treatment is on. So again, there was a misdiagnosis on one of my teeth where they said it had to come out. I didn't think it had to come out. There was then a 2-week delay to go and again, that's another department, maxillofacial. And when it came to then having the tooth taken out, the consultant then said it doesn't need to come out at all. So that was, I think that cost me about 3 or 4 weeks of delay, which but a lot of phone calls trying to sort things out. So, but that's about the only thing. That's about the only thing that sort of went a bit wrong. Again, you have to have CT and MRI scans. No problem on those, particularly if your veins are all right. Just have some stuff pumped into your veins so they can tell. That's when they give you the final diagnosis after the CT and MRI scans and an ultrasound scan. So you know, that's all things that I think, you know, maybe we could produce a checklist. You know, you got these things coming, rather than lots and lots of pieces of paper, some of which relate to that.
So it must have been quite hard because you worked in logistics. So I'm guessing you're that kind of person that can work out things and organise and navigate your way around.
It tends to be step by step.
Not everybody is like that. And it must just feel so overwhelming as it did for you.
Yes.
You know.
Yeah.
So it's a good.
But it is something that can be put into a series of quite, you know, identifiable steps, rather than lots and lots of different things.
With numbers as well, to who to contact and that.
Well, that would help. Yes.
Okay.
But then we got a fitting of the mask, and again, various people had said, I understand that the fitting of the mask is quite a traumatic experience, and I didn't know that, but my wife had obviously picked that up, and for some reason she managed to blag her way into the session where it was fitting, and so I should have brought it in with me because I still have it. You have to have your head in a mesh mask, and you're sort of pinned down onto the radiography table, and it's so that your head is absolutely in the right position, is held completely still, so the radio therapy actually hits the spot where it needs to hit. So the process where you do that is you lay on sort of quite a hard bed, and then they take a sheet of plastic mesh about that big, and they heat it in an oven to 70 degrees, put it on your face, and then press it down to mold into your face. And that's why Nikki wanted to come in, because she'd been told that was a terrible experience. You know, I loved it. You know, I've as is very, very obvious, I've never been in a beauty spa and then a spa day, but I would imagine that's what it would be like, because there's this lovely warm thing over your face, and then people pressing it down, and I really quite enjoyed that, which apparently makes me a bit weird. But
did you say to the people who were doing the mask at the time that you enjoyed it?
Yeah, absolutely.
What did they say?
They said, I said, have you ever done it? And of course they have all done it, because they've done it just so they know what it's like. And they said, yeah, you know, I liked it as well. So yeah, it's
each to our own.
Yeah, it's your own. Yeah. You know, it's you then have to, on the treatment, you're pinned there. I wouldn't especially want to be over claustrophobic, and I think if you are claustrophobic, then you probably need to tell them that, and they can help. But bizarrely, that you, on the treatment itself, you're pinned down to like that, and they say, right, you know, obviously you've got to keep still, because, you know, so you lay down like that, and the thing starts, and they've got Radio 2 or something like that on, and something like Status Quo will come on. And I don't know if you've ever tried laying down and keeping still to some sort of rock music. It's really quite difficult.
They need some calming music.
Yes.
A good point.
Yeah, yes. The actual radiotherapy itself, it sounds terrible because you're 5 days a week, 30 sessions, but each session is actually quite short. But it does take its toll as you go through. So that was a weird thing. When it comes to the peg fitting in the endoscopy, they the consultant who was doing it said, right, I'm just going to spray some stuff into your mouth now. It won't taste very nice. I like the taste. I thought the taste was really nice. So again, it's maybe this might just mean it's weird.
Maybe they should. Maybe it'll taste nice. Maybe it doesn't. It kind of gives you that idea that it's going to be horrible. And actually you're not. No, maybe that's a bit of reverse psychology. Yeah. So I think that's really the some of the, not frustrations, but it's the dental thing was a frustration because I think that cost me 3 weeks, but 3 or 4 weeks. But and you just need to understand, the NHS system moves quite slowly. It's when you've had a session with the oncology team, for example, with any of the teams, then there's a letter goes to the GP, but that letter isn't produced until 6 weeks after the appointment. So but once you know that all works fairly well. And Macmillan nurses can obviously be a help. So if you've got one, try and use them in the system. That can at least help to sort of say, right, well, I know this person. I'll go and contact this person, that person. They're usually good key workers, aren't they, to be able to help you navigate.
Yeah, absolutely.
And did you ever use the Cancer Navigator, Helen? Did you call upon her?
Yes, I did. Quite a number of times on appointments. Yes, she was absolutely fantastic.
Yeah, it's a good number to have.
Yes, she was. Yes. I didn't discover that until quite late on. Okay. That's the only thing. There was. In fact, I think yes, I discovered her really for some of the coordination on the post-treatment appointments and that sort of thing, and she's been a big help on that. Yeah, really good. And I've stolen a phrase from somebody else, but the key thing is that during that period is be politely persistent, because it's you do need to have faith in the professionals, because they in my case anyway, they know what they're doing, and the system works. But sometimes you just need to push it along a bit. So hopefully that will give a bit of an idea of some of the trials, tribulations, and some of the pleasures.
It does. I think it gives good insight, because as a big organisation with lots of different departments and somebody who's trying to navigate, it would be so easy to forget that, because we're so used to knowing what department is where and how it works and how the systems work. For somebody coming into and putting their trust into an organisation, but not knowing all this, can be quite overwhelming. Like you say, 7 different departments, and navigating all those different departments and ringing different people and coordinating your appointments, all whilst dealing with a new cancer diagnosis and everything else you've had to deal with regards to supporting family and things like that. So any insight into how we could make, and I say we, the organisation, can make life easier for patients, is is valuable. And like you say, that checklist of who would be involved and the numbers, and that might have made it easier.
Yeah. I mean, you do get the living with cancer booklet for the chemo, because that's, you know, that, but that's, you know, there's almost too much in there, and then, you know, a lot of stuff is buried, and it doesn't go out broadly enough to the rest of the NHS system, I think.
Yeah. So you get so much information, don't you, at a point of diagnosis. We often hear people say they get so much that they just focus on what they need to know at that point in time, but there might be other info in the packs that might be important. But again, that's something that we have to look into, about what we do give people at point of diagnosis and what actually is useful at that point. But yeah, it's gives us valuable insight. So thank you for sharing. So on the next podcast,
so that's part 2. The next one really is to go through the treatment itself, you know, both from what to expect and as to how, you know, things, you know, what might happen. And it is what might happen rather than what will definitely happen. But because different people react in different ways. But again, you know, I think it would have helped me if I'd known what the stages were from somebody who'd been through it. That's the thing, I think. So watch this space.
Yes, thank you.
Okay, thank you.